Welcome back, everyone. This time, we're going to look at something truly amazing, how AI is changing the world of cardiology.
Yeah, it really is incredible.
I was looking at some papers from a 2024 series in the Lancet Digital Health, and they're just packed with insights about how AI is already making a difference in people's lives.
It's a very exciting time to be in this field for sure.
Yeah.
The advancements are just happening at such a rapid pace.
One thing that really stood out to me, and I know you've been interested in this too,
Okay.
was the use of AI to spot signs of cardiac amyloidosis
Right.
from ECGs.
Yeah.
It's something that's often missed until the later stages.
Yes,
And so to be able to catch it earlier
absolutely. And that's,
is huge.
that's a key area where AI is already showing its value.
Yeah.
These AI models, sometimes called unimodal AI,
Okay.
because they're focusing on just one type of data,
Interesting.
they can pick up on these very subtle patterns in ECGs that the human eye might miss.
So it's like having an extra set of eyes, but these eyes are super powered by AI.
Exactly. That's a great way to put it.
And what other kinds of things can these unimodal AI models do?
Well, they're also being used to predict things like atrial fibrillation.
Wow.
So imagine being able to identify patients who are at risk of developing this condition
Right.
before they even have any symptoms.
Before any symptoms.
That's the kind of power that AI brings to the table.
That's pretty incredible. It seems like we're moving toward a world where we can be so much more proactive about our heart health.
Exactly. And that's just the beginning.
Oh, bro.
Things get even more interesting when we start talking about multimodal AI.
Multimodal AI. Okay. So that sounds pretty interesting.
So imagine combining the power of ECGs with information from imaging, genomics,
Right.
even wearable devices like your Fitbit.
Wow.
That's what multimodal AI is all about.
So instead of looking at one piece of the puzzle, we can see the whole thing.
Precisely. You're getting it.
I like that.
One of the biggest challenges in cardiology is being able to predict risk before symptoms even appear.
Right.
And that's where multimodal AI has such huge potential.
Okay.
By combining data from all these different sources, we can potentially identify individuals who are at high risk long before any warning signs even emerge.
That would be a total game changer, wouldn't it? To be able to intervene early and maybe even prevent heart disease from developing in the first place.
It's definitely a very promising avenue for research and one that researchers are really actively exploring. And there's a lot of excitement, especially around the use of what are called foundation models in multimodal AI.
Okay, foundation models. Those sound pretty complex. What are they?
Yeah, so think of them as kind of like the Swiss Army knives of AI.
Okay.
They're trained on these massive amounts of very diverse data, and so they can be adapted to all sorts of different tasks.
So instead of needing to train a separate AI for every specific task, you can just have one AI that can do it all.
Exactly. That's the idea.
That's pretty efficient.
It is, and what's even more remarkable is that these foundation models can actually learn from data that isn't specifically related to cardiology.
Really?
For example, a foundation model that's been trained on retinal images can actually predict things like heart failure, Parkinson's disease.
Wait, just by looking at the eye?
Yeah.
How is that even possible?
Yeah, it's the power of these foundation models.
That's wild.
They can pick up on these subtle patterns and connections that we humans might completely miss.
Yeah.
And by analyzing those patterns in the retinal images, they're able to glean insights into a person's overall health, including their cardiovascular system.
So these foundation models are kind of like medical detectives uncovering clues hidden within different types of data.
That's a fantastic analogy, and they're really helping us move towards truly personalized risk assessments and preventative care.
It sounds very exciting.
It is a very exciting time to be in this field.
It definitely sounds like it. Speaking of exciting developments, let's talk about large language models. You shared some research on how these text whizzes are poised to change the way we interact with our doctors.
Yeah, large language models, or LLMs, are another really interesting area where we're seeing a lot of innovation.
Yeah, and I think a lot of people are probably familiar with LLMs like ChatGPT.
Right.
What are some of the ways that these models are being used in cardiology?
Well, one area where they're showing a lot of promise is in automating clinical workflows.
Interesting.
So you think about all the time that doctors spend on paperwork.
Yeah.
LLMs can help automate tasks like medical note generation and summarizing patient records.
That would free up so much time for doctors to actually spend with their patients.
Exactly. And LLMs can also be used to improve patient communication.
Okay.
They can act as translators, helping to explain complex medical jargon.
Right.
in a way that's easy for patients to understand.
So it's like having an AI-powered interpreter right there in the exam room.
Exactly. And it goes beyond just translating jargon.
Okay.
LLMs can actually help doctors tailor their communication style. Wow.
To individual patients based on their medical history, social determinants of health, even their personality.
That's really fascinating.
Yeah.
I'd love to know more about how that works.
Well, let's dive a little bit deeper into the world of LLMs and patient communication then.
Sounds gotta lead the way. So we're talking about LLMs and how they can really change the way doctors and patients communicate.
Right.
It's like having a personalized translator in the exam room.
It is, and it even goes beyond just translation.
Okay.
Because LLMs can actually help doctors connect with their patients on a much deeper level.
How so?
Well, imagine an LLM that can analyze a patient's medical history and their communication patterns.
Okay.
It could actually pick up on things like hesitation or expressions of doubt that might suggest that the patient isn't fully on board with their treatment plan.
Oh, so it's like an early warning system.
Exactly.
For potential non-adherence.
Yeah.
Wow, that's pretty amazing. It is, and then the doctor can use that information to address any concerns the patient might have, and that can lead to better communication and potentially better outcomes.
It sounds like LLMs have the potential to really enhance the doctor-patient relationship.
That's definitely the goal.
Yeah.
It's not about replacing doctors with AI,
Right.
but it's about giving doctors these very powerful tools to improve patient care.
Okay, so LLMs can help doctors communicate more effectively with their patients.
Yeah.
What about patients communicating directly with AI?
Oh, absolutely.
Is that something that's on the horizon?
Yeah. Definitely think about conversational AI, like those chatbots that you see on websites. Researchers are already developing AI-guided systems that could actually walk patients through taking their own echocardiograms using their smartphones.
Whoa, at-home echocardiograms guided by AI. That sounds like something straight out of a sci-fi movie.
It might sound futuristic, but it's actually closer than you think. This kind of technology could really revolutionize how we monitor heart health, especially for people who live in rural areas or who have limited access to healthcare.
Yeah, that's incredible.
Yeah.
It's really amazing to think about all the possibilities. But with all this talk about AI and healthcare, it's important to address the elephant in the room. Are there any risks or concerns we need to be aware of?
Yeah, that's a great point. It's crucial to approach AI in healthcare with both enthusiasm and caution.
So what are some of the things that we need to be careful about?
Well, one thing to keep in mind is that LLMs are still under development and they're not perfect.
Right.
They can sometimes generate information that sounds very plausible, but is actually inaccurate.
So the AI could just be making stuff up?
Yeah, it's definitely something we need to be aware of. That's why human oversight is so important. Doctors need to be involved in reviewing and verifying the information provided by LLM.
Right, especially when it comes to making treatment decisions.
Exactly. It's all about using AI as a tool to augment human judgment, not to replace it.
Okay, I like that. And as with any new technology, there are always potential ethical considerations that need to be addressed.
Of course.
We need to make sure that AI is being used responsibly and for the benefit of all patients.
Absolutely.
Speaking of the bigger picture, where do things stand right now in terms of AI actually being used in cardiology?
Well, the majority of FDA-approved applications in cardiovascular medicine today are still those unimodal AI models that we talked about earlier.
Okay.
The ones that focus on just a single type of data.
So we're still kind of in the early stages of adoption.
We are, but things are moving very quickly.
Yeah.
We're seeing more and more research on multimodal AI and LLMs, and I think it's really only a matter of time before these technologies become much more widely integrated into clinical practice.
It sounds like we're on the cusp of a huge transformation in how we approach heart health.
I think so, but it's important to remember that it's not just about the technology itself.
Yeah.
We also need to think about the broader implications for the healthcare system as a whole.
Okay, what are some of the broader implications then?
Well, for one thing, integrating AI into cardiology is going to require some significant changes to clinical workflows and training.
Oh.
Doctors and other healthcare professionals will need to adapt to working alongside AI systems, and they'll need to develop new skills to interpret and utilize AI-generated insights effectively.
So it sounds like we might need to rethink the way we train our healthcare workforce.
Absolutely. And we also need to consider the potential impact on healthcare costs.
Okay.
AI has the potential to improve efficiency and reduce costs in some areas, but it could also lead to increased spending in other areas.
Yeah, it really is a complex equation with a lot of unknowns. It seems like there are so many potential benefits, but also potential challenges that need to be addressed.
Exactly. And we can't forget about the issue of access and equity.
Yeah.
We need to make sure that AI-powered cardiovascular care is available to all patients, not just those who can afford it or who live in certain areas.
That's a really important point. AI has the potential to either widen or narrow health disparities.
Absolutely.
Depending on how it's implemented.
It's not enough to just develop the technology.
Right.
We need to make sure that it's being used in a way that benefits everyone.
So we've covered a lot of ground today.
Yeah.
We've talked about unimodal AI, multimodal AI, foundation models.
We have.
LLMs.
Yeah.
It's clear that AI is really poised to have a huge impact on the field of cardiology.
It truly is a transformative technology, and as we continue to explore its potential, it really raises a very fundamental question.
What's that?
With all this data and power at our fingertips, what does it actually mean to be healthy in the age of AI?
That is a profound question. Are we talking about redefining our understanding of health itself?
I think so, yeah. As AI provides us with ever more detailed insights into our bodies.
Right.
And predicts our future health trajectories with increasing accuracy, our very concept of health may need to evolve.
It's like we're moving from a reactive model of healthcare, where we wait for people to get sick before we intervene, to this proactive model, where we're using AI to identify risk factors and prevent disease from developing in the first place.
Precisely. It's a paradigm shift with really far-reaching implications.
This has been an incredible journey.
Yeah.
It's amazing to think about all the possibilities that AI brings to the world of cardiology.
I agree. It's a very exciting time to be in this field.
Yeah, before we wrap up, I want to encourage everyone listening to check out those papers from the Lancet Digital Health that you shared.
Yeah.
They provide a really comprehensive overview of all the things that we've discussed today.
They're a great resource for anyone who wants to learn more about this really exciting world of AI in cardiovascular medicine.
So as we conclude this deep dive, I'm left with a sense of awe and, I guess, cautious optimism.
Yeah.
Awe at all the incredible advancements that are happening, and optimism for the potential of AI to really transform heart health for the better.
Well said. I think the future of cardiovascular medicine is very bright, and with thoughtful and collaborative efforts, AI can be a very powerful force for good in improving heart health for generations to come.
Well, thank you so much for joining us on this deep dive. We hope you learned something new and exciting, and until next time, stay curious and keep your hearts healthy.